Hello again, welcome to No Rumor Health Module 1. This is the second part of Module 1. And before we go into the second module, where we will see how we can recognize health hoaxes, we will look at some examples of frequent health hoaxes and we will explain why these are dangerous. So let's go. Health hoaxes cover all topics. However, there are some areas in which it is more common to find fake news, maybe because they generate more social interest, or maybe because they cause uncertainty or fear, or maybe because they promise very effective solutions that we would love to believe that they are true, even if we know that they are almost impossible. These areas are food, of course, during last year, the COVID-19 pandemic, vaccines, cancer, and alternative therapies. So let's learn a little bit more about them. A common example is to attribute almost miraculous properties to food. Garlic, for example, has been associated to curing and preventing many diseases from cancer to COVID-19. For example, garlic increases your longevity, garlic boosts the immune system, garlic reduces fever, or many other conditions that are related to garlic, even COVID-19. Of course, this information is not true, and garlic is not a miraculous food that can cure and prevent almost everything. The COVID-19. The COVID-19 pandemic and the uncertainty that has generated has extended the mistrust in official sources, and this is very dangerous. As a result, we have seen how hoaxes about miraculous treatments and preventive methods have proliferated. And not only these are fake and useless, but they can create a false sense of security, which can lead to start treating the disease maybe too late, and of course is dangerous. During a pandemic, it is advisable to follow the recommendations of official health bodies. If health recommendations are not followed, it is more complicated, of course, to control the pandemic. So we need to be aware of this. The fear of getting cancer, for example. The fear of getting cancer and the uncertainty of facing a cancer diagnosis lead us to search for miraculous solutions. That is why in recent years some dangerous movements have emerged, and these movements promise you another way of treating cancer that has no scientific evidence. Cancer, like many other diseases, is a complex disease and doesn't have a single cause. And it is true that some eating habits can contribute to prevent cancer, but the truth is that there is no food that can be considered anti-cancer. There is no such thing as the anti-cancer diet. This is fake. In the case of alternative therapies, they are not always supported by evidence, and they can sometimes cause even health damage. It is important to always trust health professionals and the treatments that they have proven effective through scientific studies. Another common topic in health misinformation are vaccines. It has been proved that vaccines are very effective and have great benefits for public health. However, there are rumors about vaccines, such as that vaccines can create autism or weaken the immune system, and a lot of studies have denied this information, and vaccines are safe and good for public health. Belief in this type of hoaxes can affect us in different ways and can lead us to make bad decisions. Although not every fake news emerges intentionally, it has the same potential to harm us. For example, We should never abandon treatments prescribed by a health professional without first consulting them. We must be careful because some hoaxes propose alternatives to conventional medicine, claiming that they use maybe natural products without side effects and traditional products, but maybe these alternatives do not have any scientific evidence to support them. In some cases, these treatments not only fail to cure, but can delay getting effective treatment, or they can worsen the prospects of the disease. So they are dangerous to health. There are some even pseudotherapies that claim to cure diseases that aren't even diseases. So we need to really check this information before starting any treatment related to alternative therapies. Some hoaxes can cause an exaggerated fear to medical conditions or to situations of uncertainty. Of course, they can aggravate epidemics because there are some hoaxes that invite people to stop following health and hygiene recommendations, or maybe these hoaxes encourage people to follow treatments that will have no positive effect on their health. Fake news can also lead to discrediting institutions or individuals based on false accusations, and maybe these institutions are official and it's bad for public health and undermines trust in the institutions. And they can also create a lot of confusion among patients that suffer from a disease. So this only adds uncertainty to their situation. So, to sum up, it is important not to rely on information that we receive about health issues if we don't know how about its origin. Remember that sharing hoaxes can have serious consequences for your health. Even if these hoaxes are not malicious, they can harm those who decide to follow them. So, in the next module, we will learn how to recognize health hoaxes. And in module number 3, we will learn how to fight against health misinformation. So thank you for your attention and see you on the next module.